call the November 4th meeting of the Fitchburg Board of Health to order. Shall we just take the agenda items in the kind of the way they're shown here on the schedule, or?
Sure, whatever you want.
I don't want to hold people up too much, but did everyone have a chance to look through the minutes that were sent from September 2nd?
Well said. Yeah,
Yeah.
I did.
And were there any changes that you thought we ought to?
I did not see any changes that we needed to make.
Okay.
Are we all set to motion on those?
Yes.
Okay. I motion that we accept the meetings, the minutes of the Board of Health from September 2nd, 2021, September 23rd, 2021, and October 14th, 2021, as is.
All right. And do I have a second, or? Okay, and I'm in favor also.
All in favor?
So those minutes are approved. Steve, did you want to give a update on the COVID-19 for the last few weeks?
Yes, Mr. Chairman, thank you. We are just under 6,000 cases since March 2020. Right now in the city, we have 136 active cases, and our positivity rate is around 4.3. So the numbers are looking a little better. So we're heading in the right direction. I think that we can certainly say that the city is definitely becoming a little healthier. I just don't know if that's going to be a consistent thing. If I may, I'll jump to the clinics.
All right.
On Fridays, the health department will be offering clinics in this very building at 700 Main Street. Tomorrow will be our first clinic in November. It runs from 12 to 4 p.m. Tomorrow we will only be able to administer adult Pfizer, but I hope in future clinics we will be able to offer more vaccine, hopefully next week. So those clinics will be on, right now on each Friday of the month except for the week of Thanksgiving, which will be the week of the, I believe Thanksgiving is the 25th. So the clinic on that week will be held on Wednesday. All the clinics, as I mentioned, will be held from 12 to 4. I will be sending flyers and links and advertising it a little bit heavier in the coming days, hopefully tomorrow. People can sign up in advance using a link, and if they are uncomfortable using a link, they can certainly reach out to the department and we'll get them signed up. We are also accepting walk-ups, so there's plenty of parking around the building, so we will accept walk-ups, and hopefully people will get take advantage of the booster shots as well as get vaccinated. These clinics will also offer an incentive. There will be a $25 Market Basket gift card in hopes of getting those folks that are thinking about or on the fence about getting vaccinated. Might help with that decision a bit. So we will be utilizing those in tomorrow's clinic as well as future clinics. And as testing, I'll skip to the next subject. Testing has been a little bit difficult to come by. There's only been a few days that testing for COVID has been available. So we are looking at opening a testing site in collaboration with Mock. The testing site will be held at 49 Nursery Lane. That is actually behind Dairy Queen on off of River Street. Mm-hmm. Testing will be 2 days a week in a partnership with the City of Leominster. They will be hosting 2 days as well. So we will be doing Monday to Thursday testing. Those hours will also be 12 to 4. And the reason why we're doing those days is because there is the availability of testing at the CHC on Fridays. So residents will be able to go to either Nursery Lane in Fitchburg or Doyle Field in Leominster during the week and get tested for COVID during the hours of 12 to 4. And that is also in collaboration with the Department of Public Health. And we hope to keep those test sites going until the end of the year, and if necessary, they will be held longer, beyond December 31st of the year.
Super.
So there'll be more information to come, and we will be heavily advertising it very shortly. But that's some information I can share as far as clinics and testing.
So again, the vaccination clinics will be on Fridays with the exception of Thanksgiving week when it will be Wednesday, if I understand?
That is correct.
All right. Super. And I think now that vaccines have been approved for the 5 to 11-year age group, I think that will help us to increase the vaccination rates as well.
And thank you, Doctor, for pointing that out. We have, in collaboration with Superintendent Jokola, we have ironed out the vaccination bus for our public elementary schools, starting on November 10th. Through the 18th, the Vax bus will be at each one of the schools in the afternoon after school. And we also, I believe we're going to be inviting families to come along with the students if they wish to be vaccinated. So it'll be sort of open to the public. And the Vax bus will be visiting each one of the school sites. So more information to come on that one as well.
And is this going to be just for COVID vaccine as opposed to flu vaccine being available as well, or?
Right now, it's going to be for COVID. If we come upon more vaccine, certainly we will issue the flu, but we'll give what we have at the moment.
Fair enough. Well, I think that's terrific that young people will start to be able to be protected, and from what I understand, even by the end of December, the age group may go down to even lower than that, perhaps to 2-year-olds and above, so that would be terrific. Well, I think that brings us up to date in terms of COVID. Is there anyone else who had any comments about that or anything to say? Good.
For a change?
So I suppose then we could move on to, well, to the petitions. We have Jacqueline Wetchy here again, and I think with a couple of articles to speak about.
Thank you. I do have a petition to remove the municipal mask mandate. If you turn to the next page, I look back to when this was put in place. At the time, it was following discussion of concern about breakthrough infections, but the CDC has now authorized boosters for all high-risk individuals, regardless of which vaccine they received. And we also now have available preventive prophylactic antibody treatments such as Regeneron for the immunocompromised, so those people are protected. Next page. At that meeting, Superintendent Jokola had said he wanted the mask mandate to be of short duration, but it has been in place for months now. Also, since that meeting, a state mandate has been put in place for schools, and this mandate does preserve local control, as we've seen with both Hopkinton and Ashland, even if 80% of the students are vaccinated and the Department of Elementary and Secondary Education approves lifting a mask mandate, the school committee has to approve that decision. It's not automatic. Next page. COVID metrics have continued to improve since the last Board of Health meeting. In the state cases, the positivity rate, hospitalizations, and deaths are all declining. And Fitchburg has consistently maintained a positivity rate below 5% during this time frame. The next page, mask mandates do not correlate to lower rates of community transmission. The city's orders must be rational and factual and not based on speculation that maybe things would be worse if we didn't wear masks. This isn't the best image. I was trying to get it larger, but if you look on the left, there's a map, and you can see There are 3 different colors. The lighter, well, it should be orange, looks like a lighter red or pink, are states like Texas, Florida, Georgia, and South Carolina. These states have never had mask mandates. Even many of their schools don't have mask mandates, yet they're having a lower rate of community transmission than Massachusetts, which is in red. And you can barely see underneath Texas, there's a little yellow dot. That is Puerto Rico. Yellow is the best on the entire map. Puerto Rico is doing fantastic with their community transmission. Next page. The residents of Fitchburg should not be subjected to the loss of our rights because of the Board of Health and Health Department have failed to meet their own goal of an 80% vaccination rate. Couple points on the 80%. This is outdated thinking. I've given you an article that covers that. We even see locally that other towns are using other metrics other than an 80% vaccination rate. Winchendon says if your positivity rate for the 14-day period is below 4.5, you can take the masks off. We're below that at 4.3. If we were in Winchendon, we'd be free of these masks already. Also, I believe 80% is not achievable. As of October 26, only 53.7% of the people in Fitchburg are fully vaccinated. That means we would need 10,705 more people to get the shot. At one point, the Board of Health was considering a vaccine mandate for students in the public schools. However, there are only 5,349 of these students, and many of them who are over age 12 are already vaccinated. So even if you did a mandate like that, it wouldn't even get you halfway there. Since January, you've run many, many clinics, and you vaccinated 7,500 people, but those include what I would call the low-hanging fruit, people who are eager to be vaccinated, who wanted the shot. And I don't think you're going to get to 10,705 more people with the same approach you've taken. There's too much vaccine hesitancy. I dug a little deeper into the data to see where are you failing to meet this, and I looked at the Vaccine Equity Initiative dashboard. It appears on the right in 3 different graphs, and I've also typed out for you the rates by race and ethnicity. Less than half the Hispanic Latinx population is vaccinated, and 50.6% of multiple races is also a low figure. If we go to the next page, Hispanic Latinx residents make up over 29% of the population, so the impact of their low vaccination rates is significant. You can see the top chart on the left. They are the second largest race ethnicity group in the city after white people. In addition, some of the multiple races category would include individuals who are partially Hispanic and Latinx. Now, there is nothing about this ethnic group that makes them averse to vaccination. You remember in the map earlier, Puerto Rico was in yellow because they have such a low rate of community transmission. The reason for that is they are excellent at getting vaccinated. They're right up there with Vermont. Vermont is the best state, 90% of individuals over age 12 with 1 dose. Puerto Rico is very close to that, 89.2%. Vermont fully vaccinated, 80.5%. And Puerto Rico is even better than Vermont at 81% fully vaccinated. By comparison, Worcester County, 81% with 1 dose, 73% fully vaccinated, and those statistics are from the CDC COVID data tracker. Next page. So let's compare Fitchburg to Puerto Rico. Much, if not most, of the Hispanic Latinx population in Fitchburg is of Puerto Rican descent. So why the difference in vaccination rates between here and the island? In Puerto Rico, vaccine clinics are run by Spanish-speaking persons of color. People often respond best to, quote, trusted messengers. That is, those who have things in common with them. That's why if you log onto your health insurance website and you're looking for a provider, you can search by criteria such as gender or language to find someone who has things in common with you. The CDC states that vaccine efforts should employ, quote, trusted community messengers, end quote, and use the, quote, language, tone, and format that fit the needs of the community, end quote. I checked with the City of Fitchburg HR director. All health department employees in the city are white and none speak Spanish. We also have an all-white board of health. You're not going to get to your 80% goal with the board constituted as it is. I think you should either drop this 80% threshold, which you can't achieve, or that 2 of you should resign and make room on the board for people of diverse backgrounds that reflect the demographics of the city so we can get to the 80% goal via trusted messengers, via persuasion, rather than government mandates. I do know that there's a requirement that 1 member be a physician, so my recommendation would be that Dr. Bogdasarian remain on the board and the other 2 members resign. Next page. Also, in looking at the Vaccine Equity Initiative dashboard, which you can see graphs of on the left, we see that over 80% of individuals in Fitchburg at higher risk of COVID, those over the age of 50, are vaccinated. This shows that people can be trusted to make their own medical decisions in their own best interest using risk analysis. They're doing that. Next page. It is unjust to require people to give up their liberties to protect others who have done this risk analysis and decline vaccination. Therefore, this Fitchburg mask mandate should be repealed immediately. And in closing, you all are part of the government of Fitchburg. And I would remind you that in the Declaration of Independence, Thomas Jefferson wrote that governments are instituted among men, deriving their just powers from the consent of the governed. I do not consent to your mask mandate. It is therefore unjust, and I want it repealed.
So you're asking that masks not be required in schools and in municipal buildings?
Correct. You've already got a state mandate that covers the schools. I don't think you need a city mandate at all.
Well, essentially, aren't we following the state mandate in Fitchburg?
I guess he's the one who decided to wear masks, I believe. Is that right?
I'm sorry?
Didn't Jesse, the Department of,
Secondary, elementary and secondary education, yes.
So if you repealed your mandate, there'd still be a mask mandate in the schools.
Right.
yeah,
So
So,
why do you need 2?
well, I think we're just going along with the state mandate.
I think we made our mandate before the schools came out,
That is
if I
correct.
remember correctly. I don't have the dates in front of me, but I think we made ours before.
And if I may send a reminder, we were pressed in a situation at the time that there was a bit of a spread of COVID through City Hall, and we had concerns that might begin to affect services to city residents should City Hall become an outbreak. City employees.
You know, I would agree. I think if we're essentially following the state mandate, which indicates that masks should be worn in schools until there's an 80% vaccination rate, it is probably repetitive for us to say the same thing, although I don't know what we'd accomplish by saying we're going to rescind our mandate and still follow the state. You know, it's going to end up in the same place. You might be, I know you had special concerns about the library and some of the municipal buildings.
Well, what impacts me is the library.
Right.
But just as a general principle, I don't think that vaccinated people should have to wear masks forever because other people choose not to get vaccinated. And you're not going to get to 80% with the current composition of your Board of Health and your health department. You're just not going to get there. So what you're saying is we'll be wearing masks forever, and that's not fair.
I don't believe that's true. We're not saying that. We don't want this to be in place forever. And I don't think that replacing myself and Ian because we're of our ethnicity is going to make a difference either. It just doesn't make sense to me.
Well, how else do you explain the difference between vaccination rates in among the Hispanic Latinx population of Fitchburg and in Puerto Rico. It's a huge difference. It's like 30
And you're saying it's
percentage points.
because of the Board of Health members' ethnicity?
It's because the people running the vaccine clinics there are bilingual and bicultural.
Well, that's true, and we do have we have people out there who are bilingual and multicultural out canvassing neighborhoods now, trying to get people to get vaccinated. We hope to achieve that. I mean, we have to keep pushing forward. And we have to be positive about it. And so that's what we are, and that's what we do.
So you think you're going to get 80% of the people in Fitchburg
I don't know if we'll
vaccinated?
get 80%. I hope we get 100%, but we just have to keep trying. I think with the boosters that have just come out and approval of that, and for the children 5 to 12, I hope that we can capture a lot of those kids, because the schools are getting creamed right now, literally. Schools are in trouble right now with kids that are contact tracing, that are exposed and that they're positive. So I'm hoping that we can get some of the kids vaccinated.
Well, boosters aren't going to help you improve your vaccination rate because those are people who are already vaccinated. They're already in
It
your
won't improve the
statistics.
vaccination rate, but it might improve some of the breakthrough cases of COVID.
But you're tying the repeal of the mask mandate to a vaccination rate. That's what you said in your previous meetings. You're not tying it to positivity rate like Winchendon is. You're not tying it to number of
Winchendon
cases.
has got a lot of cases going on too. I spent a good part of yesterday dealing with that. And I'll have you know that there is a private school in that vicinity, I won't name the one, but they have 100% vaccination rate with their students. And one of the administrators repealed the mask mandate. 2 days later, he came down with COVID. So as soon as the masks came off, the virus came in. So,
I'm still wrestling with what difference it would make if we were to repeal our mask mandate, except perhaps with respect to the library. And I don't know how.
Well, I'll give you an example of how it would help. Your mask mandate extends to Fitchburg State University as well. I was speaking to a student from Fitchburg State. She wanted to come, but she works until 7 p.m. on Thursday, so she was not able to be here. And she told me, we have a vaccine mandate at Fitchburg State. Everyone is vaccinated except for a very small group of students who have medical and religious exemptions. They have well over 90% vaccination rate, and they're still forced to wear masks all the time. And it's like, what did they get vaccinated for?
If they're over 90%, why are they forced to wear masks?
Yeah.
It was my understanding that once they reached 80%, they would be able to take the masks off.
No,
But
they're still being made to wear them. And it's my understanding that that mandate didn't come from the university, it came from you, because the university came to you and asked you to do the unpopular work for them of putting the mandate in place.
well, I think at least my understanding of our mandate is that once a school reaches an 80% vaccination rate, that they're able to remove the masks.
Is that written in the order? Because I don't remember seeing it written in your order.
It is not.
So that would be an example of something concrete that could be done to improve people's lives by repealing your mask mandate.
Well, again, we could repeal the mask mandate, but still the state is going to indicate that we have to have an 80% vaccination rate or otherwise continue to wear masks. So I don't know what difference it would make for us to do it, except perhaps at places like the library and City Hall.
It would also make an impact at the Fitchburg Housing Authority buildings.
Of which the Fitchburg Housing Authority did the same thing and approached us for assistance on a mask mandate.
I guess I have to wonder, when you say the Housing Authority approached you, or when you say Fitchburg State approached you, are these just the administrators, the people in charge, or did you actually ask the residents of the Fitchburg Housing Authority buildings? Did you ask the students at Fitchburg State University? You know, I asked Superintendent Jokala the same thing when you were putting in a vaccine mandate on students and athletes, students and extracurriculars. I asked him, has anyone asked the parents? Has anyone surveyed, the older students? It seems like this is a very top-down approach, that the people who have power come in and issue mandates to people who don't have any say in the process.
Well, I'm not sure it's practical to go to the Fitchburg Housing Authority and to every rest home or every home that's controlled by or managed by the city and go through every patient and try to take a poll. Same thing at Fitchburg State, to gather all the students together and carry out some kind of poll. So I think that what these institutions have done is to put their trust in us that we would make the best judgment that we could for their safety, and essentially I think that's what we've done. I think there's room for optimism. More people are getting vaccinated. We're certainly doing what we can to go out to various organizations and get people vaccinated. We're doing our best to protect the population here. Still, I think we have to worry about young people until they get vaccinated. There are still breakthrough infections, so I think that we've just done things that we can do to protect people in addition to the vaccinations. I'm not sure it's practical, as I say, to go out and poll every place that we think would be affected by this mandate and ask if how many people want to do it and how many not. I'm not sure what we would even do with the answers that we would get. So I still think that we're just trying to make the best decisions we can with respect to the safety of the population in general. Again, you've been here a few times, and I think I've told you every time, nobody likes the masks. We don't like them either. We're just doing what we can to try to keep people safe. I think that it won't be long before we're going to have this pandemic or endemic, whatever you choose to call it, under control. I think we're going to be able to be rid of these masks, but until we can feel safe about that, I think we still continue to need to use them. Young people, starting this week from 5 to 11, are going to be able to be vaccinated. It's going to protect that population. I think even younger folks are going to be able to do it too. And hopefully, once that happens, we'll be able to well, not just us, but the state will lift the mandate as well. I think no one likes these.
I think I may have given someone my copy of the article with highlighting on it.
John. Someone.
Oh, okay. Mr. Chairman.
Podium.
Yeah, yes, please.
I'm a retired philosophy professor. I was asked here by this lady. I have a couple of questions.
I'm sorry, who are you?
John Strang, S-T-R-A-N-G.
Okay.
I have a couple of questions. First of all, you have alluded to the state mandates requiring certain actions. And this includes the wearing of masks on city properties, as I understand it, as well as schools and so on. If that's the case, why are there differences between the mask policy in Fitchburg versus, say, Leominster? In the past few weeks, I've been gathering initiative petition signatures for, among other things, the requirement to carry a photo ID when you vote. And I've had occasion to visit other city halls and town halls. And in the area, Fitchburg is the only city hall that's requiring wearing a mask. It's not required in Leominster. It's not required in Lunenburg, for example. Mm-hmm. Well, that's one question. Another question is in regard to, is it Ms. Green?
Me?
Yes.
Knipe. Miss Knipe, Mrs. Knipe, whatever.
Okay. Well, you made a reference to somebody who got COVID, I think it was at some private school, immediately or soon after the requirement to wear a mask was eliminated. This is an informal fallacy of reasoning. It's called post hoc ergo propter hoc. The assumption that because something occurs in time after a certain event, therefore it's caused by that event. We don't know that the
No, we don't know. I just stated
let me
what
finish.
happened.
We don't know that, in fact, the cause of the individuals getting COVID was the removal of those masks at that
You're
time.
right.
So that's an
Right.
assumption. You cannot present that as a rational fact, is my point,
Okay.
an assertion. Okay? I have other comments to make. I don't know how long I should continue because I don't want to interrupt your delivery here, presentation.
Go ahead.
Well,
Could I just
yes,
interrupt you with respect to Leominster, and you said Lunenburg was the other community?
Lunenburg and Leominster do not require, when you enter their city halls, you don't have to wear a mask.
Right, and I don't know on what basis they made those decisions. That's all I can say. Perhaps they're a little bit less concerned about patient and population safety than we are. I don't know. I mean,
So that's, again, a presumption. They could say the same thing of you. Perhaps your attitude, this board's attitude, is overprotective. Or as I think Ms. Wenchie is saying here, is it Wenchie? I'm sorry. Yeah. As she's suggesting, there are certain intrinsic rights that American citizens possess. And the impression I'm getting is that you're implying that the rights administered through the Board of Health somehow take precedence over those individual rights. That's the crunch of the issue here. Do they? And what grounds do you have as a Board of Health for maintaining that?
well,
They claim to make. And the fact that there are exceptions to this in other administrative areas, which presumably have the same mandate to contend with, suggests that you don't have such a right. So she's asking you effectively to rethink your assumption here.
Well, I think that what we're concerned about, again, is the health of the population of Fitchburg. I don't think we're taking away rights when we...
Well, that's just the point. That's precisely her point. Now, in my own particular case, it doesn't make much difference to me whether I wear the mask when I enter a city building or not. But her point is getting to an essential issue, and that is that there is no authority for this under the Constitution in the broad, sweeping manner in which you're presenting this. That's what she's bringing into question. And that's something I think you will each have to rethink. If I just may quote from something here, a paper I brought with me. Recently in the United Kingdom, an incident occurred in regard to a related issue. A deleted government report exploring how to make the public alter its behavior in order to accept certain new policies, for example, a green economy, reveals how COVID-19 restrictions have created a population with, quote, a deep-set reverence for authority, and, quote, a powerful tendency to conform. The report was inadvertently published by the British government before being hastily pulled down, but numerous journalists were able to retrieve its contents. The document explored how to weaponize behavioral psychology to nudge the public into supporting measures and adopting behavior without them explicitly knowing that they were being manipulated. The investigation found that the same techniques the government used to force people into accepting lockdown could be used to make them change their lifestyles in the name of preventing climate change, for example. Under the heading of Principles for Successful Behavior, the paper noted, government statements, actions, and laws powerfully shape perceptions of normative and acceptable behavior. For instance, even with public criticism being high, many still perceive government approval as the yardstick for safe behavior during COVID-19. This reveals for many a deep-set reverence for legitimate government authority, regardless of one's personal political views. What this paper is implying is that there's a presumption on the part of the public that when a governmental authority makes certain policies, these policies have to be right, the authority has to be essentially unquestioned. And I think what Ms. Wenchie is saying here, what she's implying is that, well, we have certain basic rights here. And these rights arguably have precedence over the assertions of government authorities. And that doesn't answer the question to say, and I don't impugn you when you say this, it does not answer the question to say we're trying to seek the best interests of the population, ensure their health. No one is doubting that. I don't think anyone here is doubting your integrity. But you do have a fundamental issue here, and that is the issue of precedence here. Do the citizens have the right, or does some governmental organization have the right in the end?
Mm-hmm. Well, I think that again, what we're doing is based in science, first of all, requesting that people get
Well, that's
vaccinated.
questionable, too.
Well, I think the best science out there, listen to what the CDC says, Dr. Fauci.
Dr. Fauci's been very, Dr. Fauci's position has been questioned across the board. Most recently, I maybe saw today's testimony.
Well, I think you don't want to listen to the science, first of all.
I don't want to listen to the science. I don't think that's the issue at all.
Well,
I'm a PhD in philosophy. I'm open to listening to any scientific assertion. The point is that some of them are ambiguous. In her papers, Ms. Wenchie has cited certain statistics that seem to suggest that, well, certain societies are doing perfectly well without a mask mandate.
Yeah, but you're comparing whole societies, and I think, it becomes very difficult when you start comparing societies this way. I think that we're essentially following the scientific recommendations that come.
This is an easy way out, sir, to say we're following the scientific recommendations, as if these recommendations are unambiguous, and as if the facts actually play no role in this.
Are you saying that vaccination?
I'm saying the facts, if the facts, for example, in Puerto Rico show that without these mandates, without these mask mandates and so on, even without the level of vaccination, they're still doing well. And there are other countries that bear this out. That suggests that there's something wrong with the conception you have of what the science is here, if there's ambiguity about this.
Well, I think that if you compare certain countries, there are great differences in how people interact, how they mix, where they spend their time.
Isn't COVID-19 in Puerto Rico the same as COVID-19 in Massachusetts?
I don't know. It may be.
You don't think it is? It's a different virus?
I've given you opportunity to speak. I think you should do the same with me instead of interrupting me every time I try to say something. So just from that standpoint, again, I don't think you can compare societies and say that Puerto Rico is the same situation as the United States, and so if they don't wear masks, it's fine. I don't know how many people are in City Hall in Puerto Rico, how many people are in school, how they interact day to day. I think there are differences. So I'm not sure that those studies are a good comparison. Again, we're doing what we think is best. What Leominster does, what Lunenburg does is up to them. I think we're not trying to infringe on anyone's rights. We're simply trying to keep everyone safe as best we can. The alternative would be to say, okay, nobody wear masks, just go ahead. And, we would, how would it be if people came in here and said, gee, you didn't protect us at all. Now look at how many cases of COVID we have, how many people are ill, how many deaths we're having because you aren't doing the safe things.
If I could make a few points. The first time I met with the Board of Health, you had said, Dr. Bogdasarian, that masks are only 20% effective. That was a statistic that you put out there. So I would think if any of you were working in a hospital, in a COVID ward, all the people were COVID patients, and you were told, oh, just wear any random cloth face covering that's going to protect you from COVID, that you wouldn't accept that as satisfactory. It doesn't stop the small COVID particles.
Well, I think any mask is better than no mask, and 20% is better than 0%. So I think that any protection that one can do is fine. I'm really not certain what it is. Granted, you may have some deeper concerns about personal freedom and rights, but if we just go to masks, I'm not quite sure I understand what kind of a major imposition it is on you to go into a library for an hour or 2 hours, whatever you do, and have to wear a mask to protect other people.
I told you that I almost fainted, I felt dizzy, I felt nauseous, and you had no compassion at all for what I went through when I went to the library trying to wear a mask there.
Why do you say no compassion? What
Because you said, well, you have to wear one anyways. We're not going to repeal the mandate, and, basically it was too bad for me.
Well,
you said, well, maybe colder weather will come and then it will be more tolerable for you.
Right.
You really didn't care.
Yeah, and that has nothing to do with compassion. That's just the reality of it. You're one person. We're dealing with a city of 45,000 people here.
Also, you mentioned Dr. Fauci, and I don't know if you've seen the clip by the comedian Jimmy Dore. He has a clip called Fauci versus Fauci, and it quotes Dr. Fauci contradicting himself. Sometimes he'll contradict himself. In the very same interview, he'll say contradictory things. I think he's lost a lot of credibility, and you should probably find a better person to see as a medical authority than him.
Well, I'll take your suggestion. Anytime you want to come up with someone, I'd be happy to listen to him and read what he has to write.
Dr. Scott Gottlieb.
I listen to him every Sunday. I know Scott Gottlieb.
And Dr. Scott Gottlieb, if you look at my petition, there's a reference to a Face the Nation show that he did, and he said the immunocompromised can be protected with these preventive prophylactic antibody treatments. They don't need to, live in fear of COVID.
Well, I listen to Scott Gottlieb on that very program every Sunday morning, and I'm not sure that he's advocating that we utilize prophylactic treatment. I don't think it's even available to everyone as yet.
It's available off-label use for compassionate use.
Yeah. Well, I think you've made your points, and I appreciate the comments that you've both made. Did you have another petition that you wanted to discuss with us?
Yeah, I did. This one is pretty straightforward. I'll just read through it.
No.
I'm sorry, did you have something you wanted to say?
No, I'm good. I'm okay. He pretty much said it all.
So my second petition is to prevent special interest money related to waste pickup. I think the city should serve the interests of its residents and not special interest. Special interest money clouds the integrity of the procurement process and can lead to conflicts of interest. There is already a code of ethics prohibiting city employees from receiving gifts, but it does not cover this situation. Therefore, I would like effective tomorrow for all elected officials in the city to be prohibited from accepting campaign contributions from waste haulers, their executives, and their lobbyists, and any elected officials who have received such campaign contributions be asked to voluntarily return those contributions.
And on what are you basing this? Do you have some information that there are political candidates or people who hold political office who are receiving money from, I would presume you're talking about waste management?
Yes, there is one elected official who has received a campaign contribution from them.
Do you know what the size of that was?
It was $100.
Uh-huh.
Isn't that allowed under the conflict of interest law?
You're asking if it's a conflict of interest to receive a contribution?
Well, the conflict of interest law that we have to read and abide by as Board of Health members, I believe that's allowable, up to $100. Am I correct?
Allowed up to it.
No.
It may be.
I
I'm
remember
not
correctly.
certain. Nobody's ever tried to give me money, so I
know, me
don't really
neither.
worry about it. But
Steve,
I'm not aware of this. Certainly, I think you're making a good point that if there are people who hold political office or candidates for office who receive money, and it should be a substantial amount. I'm not sure that where $100 is going to swing an election or make swing someone's opinion, but it is something that certainly we should take under advisement and look into.
I don't know if I may, Doc, I don't know what authority this board has over such a petition and donations, and I don't think, this isn't a petition for this board. Maybe it's a petition for the council, but I don't see the relevance as far as this board goes.
Well, I think that's a good point. I think, do we have to do with selection of the waste management company per se?
So, Chapter 30B is in place, which are the procurement laws. Rubbish collection and rubbish disposal is exempt from Chapter 30B. However, we still do go out to bid upon the completion of each contract, just to get a rough idea of what other companies can offer. So we have gone out to bid for the last, I don't even remember, I've been 28 years, somewhere around that.
And when you say goes out to bid, who makes the decision as to which company will do the waste, handle our waste? Is it the Board of Health or is it the
It would be the Health Department Director and the overall Board of Health. Sure.
So none of us here, at least as far as I know, has ever received any money from any waste management company, or we don't run for election, so
None of us are elected, no.
none of us is elected, so there's no campaign contribution here. So if we're the ones who make the selection, it really wouldn't matter if somebody from the city council, for instance, gets money, because that person doesn't have any say in the selection of the waste management company.
Sounds
Correct.
like a campaign finance law question.
Yeah, I think,
Corporations can contribute to campaigns up to a certain amount.
I think from what I understand, we're the ones who make the decision as to who's going to be, selecting the waste management company. None of us is elected, so we don't receive any pay for what we do. We don't receive any contributions, and we don't speak to lobbyists. As I say, we have no real interaction with them. I think if you have concern about city council members, this might be something to take to the city council, but I don't think they have any say in who the waste management company is, if I understand.
That's correct.
So you might not be in the right place for that particular petition. If you have some concerns about other organizations that are hired through the city council, again, I have no idea of who does what there in terms of campaign contributions, but if you want to make it clear that you don't think that anyone there should be open to any influences, that's certainly fair enough and reasonable. You could take it there. But at least in terms of the waste management company, I think we do the selection, and none of us gets paid anything, and none of us has ever received or even been asked to receive any kind of gift or any money. So I don't think it's something that we really need to act upon. I think we all sign a conflict of interest statement, and we've all done that, and again, I think we've all held to it. No one has ever approached any of us, as far as I know, with respect to that. But again, thank you for looking out, and thank you for your concern. Is the petition, the initial petition, something that we need to make a decision on this moment, or as far as you know?
I think there should be an official approval or deny to the petitions.
No. Well, again, I appreciate everyone's comments and arguments. Perhaps I'm a simple person. I'm not going to be concerned. Again, my main concern here, and I think the concern of our whole board, is to do the best we can to preserve the safety of the population. I don't think we made up this, all of these safety considerations. We based them on what's been recommended nationally and through state organizations, and essentially have adopted those. And I think that they continue to be of the belief that 80% vaccination rate is something that should be attained before masks should be discarded in the schools. And so I make a motion that we continue to recommend or to mandate mask use in the schools until the 80% vaccination rate or some other therapeutic modality comes about to prevent spread and becomes adopted as a safe treatment. I think that we should continue the mask mandate until that comes about. As far as municipal buildings go, I think, you know, if the mayor is sitting in his back office and there's nobody within 50 feet of him, I don't think he needs to wear a mask during that time. But I think when you start having people congregate, I think masks should continue to be utilized. So I would make a motion that we continue the mask mandate as we have been.
Second.
Do you have a comment before?
Yes, I do have a comment because I read the order that you put in place back in August, and you said that the standard you were looking at was that the CDC said if an area is in if a community is an area of higher substantial transmission, then masks should be worn. You referred to the CDC guidance, but now you're talking about a state guidance for the schools, which is 80% vaccination. So you're like mixing in two different things together. One thing is what you wrote in your order, and another thing is what you're saying now. I think that, you know, you should drop that whole 80%. It's already covered by the state for the schools, and you should look at a realistic measure that you can actually achieve. And if you can't achieve it, you should step aside and let new people come in who can achieve the 80%, because you're not going to get there. You're not going to get to 80% in Fitchburg. You're 53.7. You've been vaccinating people. You know, you've been holding, you know, over 70 vaccination clinics. You've been working hard, but you're just not getting it done. So either change the metric or get different people to do it.
Or continue to utilize the safe practices that we have been, because we can't quite attain it as yet. We will keep working at it, and I think eventually we'll get there. But until we do, I think at least I make the motion that we continue to leave this in place. Whether we change it and say, you know, we'll follow the state mandate, which is essentially the same thing, I'm not sure that we need to do that. We're essentially following it, and it may be duplicative, but I don't see a problem with both of us saying the same thing. So again, I make the motion that we continue the mask mandate as has previously been instituted and written.
And I second that.
I'm in favor.
Yeah, so I think we're going to continue as we are.
So the last page is the order in this packet, is the written order, which is page 29.
Okay, this is the one that we...
Oh, I don't think there was...
Okay. Right. Good enough. Yeah, just with respect, sorry, with respect to the second petition, I would also make a motion that we really don't have, since we're not, I'm trying to think how best to put this.
Yeah.
I would make a motion that if you have concerns about, and I'll generalize it to say lobbying and campaign contributions and contributions to elected officials, that those be taken to the city council, because the Board of Health really is not, we're not compensated individuals, and so I don't think this has any relevance to us. So my motion would be that this petition, should you wish to pursue it, be taken to the city council for their consideration.
I'll second that one.
I'm in favor.
All right, so thanks very much. So should we move on to number 4 then?
I think so, yeah.
And this has to do with the vaccination mandate of Fitchburg Public Schools students participating in extracurricular activity to be amended to testing mandate only.
That's correct. So
So-
this,
Go ahead.
I was just going to say, is this the amended paragraph that we're talking about right here?
that is the amended paragraph, yes.
And
Did you want me to read that, or?
Maybe I'll read it for you.
If you like, sure.
So this would be considered an order mandating testing in Fitchburg Public Schools. It would be Board of Health Order number 2021, number 4. Whereas the Board of Health recognizes the importance of providing a health and safe environment for staff and students to respectively work, teach, and learn. Whereas the public health experts have determined that it's possible for an infected individual to transmit COVID-19 even when the individual does not exhibit symptoms of the virus. Whereas due to the number of individuals in the Fitchburg Public Schools, students and staff have the potential to be in very close proximity during many activities. Therefore, the Board of Health of the City of Fitchburg orders that mandated COVID participation in COVID testing. City of Fitchburg Board of Health hereby mandates all Fitchburg Public School students and staff participating in extracurricular activities, whether vaccinated or unvaccinated, be tested for COVID-19 on a weekly basis or as necessary to reduce the spread of COVID-19. Extracurricular activities shall include any function where students and staff gather where there is the potential of spread of COVID. Examples of extracurricular activities may include, but are not limited to, school-related activities such as sporting events, plays, band, or activities where the potential for students and staff to gather in non-academic activities is present. The order goes on to note that all employees and students participating in extracurricular activities related to the Fitchburg Public Schools must provide to the Fitchburg Public Schools evidence of a negative COVID test at least once a week or otherwise necessary to prevent the spread of COVID. Fitchburg Public Schools shall make reasonable efforts to make free COVID testing available to all employees and students of Fitchburg Public Schools to assist in meeting this requirement. The requirements of this order are independent of any federal or state order and any policy of the Fitchburg Public Schools. This order shall remain in effect until the Fitchburg Board of Health rescinds it. So ordered, members of the board.
Does anyone have comment on that? Then I would make a motion that we accept this amendment.
I second that, if that's the motion. I will second that.
In favor?
Then that is accepted.
Well, that's all I have.
I make a motion that we adjourn.
I guess I,
Yeah, thank you.
When the next meeting will it be the first Thursday in December?
the next meeting, did you say? I believe it will be the first Thursday in December, yes. As far as you know, right, Steve? We'll be meeting first Thursday in November?
Correct.
Yeah,
December.
yep. You going to come with some more interesting things for us?
Yep.
Okay. Well, I make a motion that we adjourn then. We are adjourned, we already made the motion.